Not one word was mentioned in our entire curriculum about the endocannabinoid system. As my mom described, this is a system that underlies the physiology of every system in our body. So how did we go through 4 years of medical school, 30 years after the discovery of this system, and not learn one thing about it? I think I've heard maybe now there are 4 or 5 medical and nursing schools that are starting to teach the endocannabinoid system. But when you go and you start reading the research, reading papers about how this system works, what the system does at the physiologic level, what it does when our body starts receiving insults, and those insults can be through the environment, pollutants, through what we're eating. It can just be stress, overwork from our jobs, or being run thin because of our family obligations. All of those things can start to create dysfunction in the endocannabinoid system. So it's incredible to me that, as professionals who are supposed to understand physiology and the pathophysiology of our bodies and how to correct those things, that we wouldn't have learned about a system that underlies all of it. So to just add a little bit about what we do at our clinic, when we have patients come in and we start listing their conditions and trying to understand what their medical history is, we put that into the context of, is this an overactive endocannabinoid system? Is it underactive? How can we correct this, whether that's with cannabis, food, exercise, yoga, acupuncture? How can we start trying to get this endocannabinoid system back in balance? Because when we throw, pharmaceuticals or topical things or over-the-counter things at these conditions, we're throwing things at symptoms. We're not throwing things at the underlying cause. So what we believe is that by understanding how the endocannabinoid system works and understanding how we can modulate it, we can actually get to the root cause of what's causing a disorder.